No longer do nurses just say yes, doctor. They do a great deal of procedures in their own right and are in decision-making positions within the healthcare service. They're also very important as occupational therapists, physiotherapists, counsellors. There's a huge increase in the number of women in important positions in medicine, and I think that that's been a very good thing. The one thing that is difficult, of course, is that the costs of medicine are rising at an astonishing rate. Your president did say some years ago, I remember, that if the cost of healthcare in America continued to rise at the rate it did, 30% of the GDP would be taken up with healthcare by 2030. I think it's about 17% now, and of course that is impossible. European countries are at a lower level than that, and I think we probably get better value than you do, because my own profession are very enthusiastic chargers in whichever country they may be, and this is to be watched very carefully. The vast majority of improvements in women's health in the last century, where there was a dramatic increase in the lifespan of both men and women, have been due, in fact, to changes in social conditions. There was a huge improvement in housing, not to mind the introduction of clean water. This must have been one of the most important things for everyone. And it's only when you think of how we waste water and how parts of the world have so little water that you realise its importance. We can't go around drinking bottled water. There has to be a good public water supply. And you really get to value that when you go sometimes to the developing world. I was in Uganda one time on behalf of UNFPA, and we were trying to talk to women there about washing their hands before dealing with their small babies in particular, because neonatal diarrhea and vomiting were terribly common cause of death of little infants. And I remember this woman saying to me, "I'll kill anyone I find washing their hands when I think of the distance I have to carry that water." And I mean, who can blame her? She was carrying it from the river miles away. So let us value what we have and be sure that we conserve it. You do find that we run into trouble in the developed world with water supplies if we're not vigilant. So this is one area where I think we could easily find ourselves going backwards if we weren't very careful. Not enough money is frequently put into public issues like this. It's not very sexy, to say we're going to replace the mains or something like that. It's much better. You can't see the mains, so it's much better to spend the money on something that people will see. Also, a huge number of the epidemic diseases have been eradicated, got rid of, indeed. Probably not if you can't remember the need for vaccination for smallpox. Now, it wasn't a joke. Smallpox vaccination was quite something. A lot of children got sick, and occasionally the condition became widespread in them and they died. But due to a worldwide campaign, we eventually got rid of smallpox about 20 years ago. And this was a terrific advance because it had a mortality rate of about 30%. And when you think of air travel nowadays, it is almost impossible to avoid getting involved in diseases which are prevalent in other countries if you're going anywhere at all. And I know that all of you are in situations like that. There was a terrible problem about 30 years ago where Nile Valley fever, which is transmitted by birds, arrived in America. Now, it had never been in America before till about 1980, and it must have come into New York, somehow birds on cargo planes or something like that. And this condition is now all the way down the east coast of America and has been found as far away as the Mississippi Basin, and is probably travelling upward as we speak. So to try to isolate ourselves is terribly, terribly difficult. We have to have a sort of duty of care to each other. One thing that worries me very much at the moment is the situation in Greece. Greece, as you know, is in an appalling financial situation. And the big pharmaceutical companies have stopped supplying drugs to the Greek government. Now, I mean chemotherapy, I mean vaccinations, I mean insulin. Now, you know, okay, diabetics will die if they can't get insulin, and presumably, hopefully, the World Health Organization is going to try and do something about this, but all of us are going to be affected if the vaccination rate in Greece drops. It's not just going to be the Greeks, it's going to be all of us. We had nearly eradicated polio. Nearly eradicated. There was a huge effort made, and about 8 years ago we were nearly there. When in the north of Nigeria, a very influential Muslim leader, who was also a doctor, decided that the American vaccine wouldn't do. And before they could make the vaccine somewhere else that he would find suitable, polio had got going again, down there with Burkina Faso, Nigeria, up in that corner there. Then the next thing, the same strain was found in Indonesia. And this had got there. A 2-year-old child got it, and a 2-year-old child died. This had got there because people had come to Mecca. You know, people travel nowadays, and people come to Mecca. Someone in that child's family must have got infected. Maybe they were asymptomatic, and back they went. So here we are now with polio, quite a problem again in a lot of countries. So many of our efforts have got to be global before they really make a huge difference at home. That we can't just say, that's pity about Greece, because Greece is right there beside us. You know, people going through it all the time. The airport in Constantinople, the airport in Anchorage, just down the road, big crossovers between Europe, between America and the Far East. So we simply cannot isolate ourselves without realizing that this would be to our detriment as well as the people in that country. There are, of course, problems specific to women in which there has been a huge improvement in the last century. And any of you who look back through your family histories and see the age at which great-grandmothers died and so forth, will be absolutely astonished. Because, of course, women in their 20s and 30s died very easily, and this, in general, was associated with childbirth. Now, the improvements in the care of women during pregnancy and labour and after childbirth have really been dramatic. And antenatal care was given virtually no credence at all until about 60 years ago. And then it was realised that if you tried to pick up problems before they occurred, you were very likely to be in a better position to deal with them when the woman in fact went into labour. The arrival of analgesia and anaesthesia were very important as well, because you could do procedures on the woman which you weren't in a position to do before. And the advent of a good blood supply. I was in West Africa one time, and again for UNFPA, and I was horrified to see how very easily young women died from bleeding, and the bleeding to me did not seem to be massive. And I remember saying to a professor of obstetrics from Côte d'Ivoire, we were speaking a bit of French and English, what on earth was going on? I said, the woman lost hardly any blood, she lost the woman. We lost the woman, she said, because the woman's hemoglobin when she started was about 6 or 8. You know, but it should be about 13, 14. Take it a bit down if you like, with a woman to 11, 12. But, you know, if you're trying to deal with a person who is really an ill woman before she's going into labour, you're in a terrible situation. And then if you don't have a secure blood supply there, it is incredibly difficult as well. By the way, I had thought that most of this anemia was probably due to malaria, but you know what it was mainly due to? Intestinal worms. Now, you may remember when George Bush was president, he decided to stop giving UNFPA money, and the American contribution was very important. It was very big, about a third of the budget. And he's decided he wasn't going to give any more money. He somehow got the notion that abortion was being promoted, which I had never seen in my entire time with them. So I took to writing to him and to Laura to ask them if they wouldn't send money for tablets for intestinal worms, because I couldn't see that anyone would be against getting rid of intestinal worms. I said I would make a promise that it wouldn't be spent on anything other than getting rid of intestinal worms. I never really got anywhere with it. What a more sensible letter from Laura's secretary than I got from anyone. I thought of writing to the two girls, but I sort of got fed up with that stuff. But it is amazing the sort of things that can make a difference to women's health. Intestinal worms. I mean, who'd have thought that? I certainly didn't, and I'm a doctor. I never thought that there could be such a serious condition. So, there's a huge number of things that you don't really think of. You think your cesarean section is terribly important in obstructive labour, and that indeed it is. But of course you really don't want to start off doing sections except in a very serious emergency without some blood there. And most of these countries, their blood supply is nothing like as developed as ours. Contraception. Contraception in the middle of the last century really was a godsend to women, and I mean that. Because of course, it made a huge difference. Maybe it's more about controlling the number of children you had and so forth. But as a doctor, the thing that really mattered to me was the fact that sick women didn't have to get pregnant. I had a professor of obstetrics who used to say, remember, pregnant women get sick. Nothing to do with the pregnancy, she just gets sick. And sick women get pregnant. And we used to lose about 30 women a year in this country in the mid-60s because contraception was illegal. And it was very much frowned on by the church, and the church ran the show regarding this was concerned. Mary Robinson was a friend of mine, is a friend of mine. And I remember when she asked me if I would help her to run for the Senate on the Dublin University panel, the one on which I was elected on subsequently. And I remember I had met her at the end of Grafton Street near Trinity, and she said, look, I want to run for the Senate. I want to try to do something about getting contraception legalised here. Now, I didn't want to let the side down my search, but I was amazed. So I almost leant on the wall. I can remember what she was wearing. She was wearing a white trouser suit. And I said, well, what if you like, Mary? I'll certainly try to give you a hand. But I was absolutely astonished at her courage. Now, that was in 1972. It's not that long ago, And there were terrible problems here. When she first put her private member's bill on the order paper in the Senate, the leader of the Senate wouldn't hold it in his hand. Something terrible would happen. Anyway, so the contraception was a hugely important issue. Very important indeed. And the big thing to me was the fact that women who were really not fit to have children didn't have to have them. Abortion is a very fraught issue. It is illegal in this country only in certain circumstances, and certainly my own views are pretty conservative. But we do have to face the fact that a huge number of women died of illegal abortions and are still dying internationally. And it just has to be faced up to, and countries have their own ideas. One thing though I do have worries about, and that's what are described as late abortions. Abortion to me is the termination of pregnancy before the child is viable. And of course the child is viable now from about 24 weeks. So you have to be really careful about what you're talking about and the termination of pregnancies after that. Probably things have been very much on the up for women's health, but there's been a downside as well. Because many of the diseases that we really have trouble with nowadays are caused by lifestyle. We don't have starvation in the developed world world, but we may have malnutrition to a greater extent than we think because of people eating very badly. But of course, the most serious issue we have to deal with is gross obesity. And there's no good people saying they're large. Do you see this? That's fat. It's not large. That's fat. And there's no good saying I'm large. No, it's not quite There's no good in saying that. And we used to think, when I was doing medicine, that fat was just sort of blubber that hung around you. But now we realise that actually blubber has a life of its own. It does a great deal of damage. So that you have to take it seriously. And I think this is where women are desperately important because they are the gatekeeper of diet to a great extent. Children can drink a glass of water, and in fact they do with their dinner. There's no need to give them something that's full of calories. And even if you're giving children and anybody, calorie-free Coke or something like this, apparently the various chemicals which make it calorie-free have an effect on your brain and affect the appetite process in it in a certainly not very good manner. So we have a shocking problem with obesity, and I think it's now recognised, unless we're trying to start with children, that it's gone too far by the time as adults we're trying to tackle it. You actually can lose weight though, because I had trouble with my left knee. I look much younger than I am. And I had trouble with my left knee last year, and I went to see this orthopaedic surgeon, and he said cheerful things like "Anno Domini" and things like that. That was better than saying old age, I suppose. But anyway, he said that, and he said that you don't. It's just a bit of wear and tear. You don't need much done with it. I said, "It's a bit of trouble." But he said you could lose a bit of weight. So, you wouldn't believe this. Do you know I lost 10 pounds or more in a year by simply not having a second glass of white wine before dinner, not having second helpings. Second helpings are lethal. You don't need second helpings and a bit more portion control. There's no way about you really don't need to go to diet. You just need to eat and drink less. And it's not that difficult. You know those terrible big glasses of Chardonnay from the Napa Valley? Forget them. And you're drinking red wine for the iron, because it's better for you. So you really can just make lifestyle changes like that, which aren't terribly difficult. But I think trying to watch the whole family is desperately important, because the association between obesity and type 2 diabetes is now shocking. And type 2 diabetes ain't no joke. It really isn't. It's the commonest cause of blindness in people of working age. It causes heart disease, it causes you to lose limbs, it causes your kidneys to shut up. It's really very, very serious. And there's no good in saying I've just a touch of diabetes. I certainly wouldn't like to have it myself. And of course it also is important with heart disease, and more we see with various cancers. So I think that's one of the most important issues to address. We have, as well as that, the issue of smoking. I really get so disappointed when I watch the following. We live very near here, and a lot of people get off the Lewis, that's sort of, little train that runs along, and they're walking along the canal at a great rate. And I think, isn't that very nice now to see everyone walking in the morning? Then I notice they're dragging on a fag as they're going. Isn't that very disappointing? They can't smoke on the Lewis. They won't be able to smoke in their offices. So they're walking down the canal in the fresh air to just take in as much nicotine as they can before they get there. And that's really very, very disappointing. I couldn't believe it when I saw for the first time, and I was in the Tower Hamlets in England, I saw that the incidence of death from cancer of the lung had exceeded breast cancer in women. Now, there had been a huge, of course, improvement in the treatment of breast cancer in women. So that was very good. It really dramatically improved in my lifetime. And, 4 out of 5 definitely will be alive at 5 years. Early diagnosis is important, but treatment is important too. I wouldn't say to you at the moment that someone said, well, my sister's got breast cancer, which my sister did 15 years ago, and she's delighted to say, was at my son's wedding last week. I wouldn't say to anyone, that's terrible, isn't it? So we'll thankfulness to that and not such and such, because the cure rate is so good and improving by the hour. So smoking is a terrible problem. It's, as I say, you get other diseases as well, wheezing and emphysema and all these sort of things, but lung cancer is not funny. Of course, there are improvements being made in the treatment, but it's nothing like the disease that breast cancer is. The abuse of drugs, both illegal and prescribed, is an awful problem. The medical profession are, to a certain extent, implicated in the prescription drugs, but people like pills. They like getting pills. If you don't come away from the doctor with a pill of some sort, or in France, 5 things and several of them suppositories, you really didn't get good value. If you're told, you should go home and go to bed for a couple of days and you'll be all right. Very important. But there's a terrible problem with antidepressants. I don't know if you know it or not, but there's I can't remember the exact name of it now, but the American Psychiatric Association had a book which, when I was a young doctor, was about that thick with the number of mental illnesses that were described in the country. Now the book is about this thick. And there is serious worry about it, about the medicalisation of really emotional problems. Apparently, if you're not all right after a death in the family, after 6 weeks, there's something mentally wrong with you. But I would have thought there might be something the matter with you if you were. Especially supposed to be someone unexpected, supposed to be a child, supposed to be someone in the forces. I mean, it's not like someone losing an adult in their 70s. The grief could be absolutely shocking. And I have heard people say, I never got over the death of my son when he was 30 or things like that. I'm sure she didn't. You don't expect life to go that way around. So how one could describe that as an illness, I don't know. And the prescription of antidepressants is very widespread, and sleeping pills. And one would wonder, really, if they aren't very heavily overprescribed. The other lifestyle thing that's a problem there, of course, is alcohol, glasses of Chardonnay. And loneliness is very important with this. People drinking on their own because they're lonely, and it's quite hard sometimes to get yourself out and about, especially if you're feeling pretty miserable at the moment. But it's an area that I think the whole area of emotional distress needs to be looked at more. There's a lot more talk therapy now than there used to be, certainly here. But there's no good having a waiting list of a year to see someone who is capable of seeing you. That just won't do it all. But we really have to remember the pressure that the big pharma companies put on for the prescription drugs. Remember what Kurt Vonnegut said: the hand that stocks the drugstores rules the world. And he was right. It's terribly important. Big pharma has a huge hold on all of us. We see increases, of course, at the same time, which makes the situation regarding obesity such a fraught or even worse, eating disorders and anorexia nervosa, common now in young boys as well as girls, but nothing like as common, of course, as the development of obesity. A very important issue, I'm trying to finish up with them, a very important issue is screening. Billions are spent internationally on screening, and well, there are pros and cons for it. Screening for cervical cancer is very important. The vaccination coming in is important too, but remember, cervical cancer is caused by the human papillomavirus, which is transmitted sexually, and the vaccination only covers 80% of the viruses that are there. So we have to look carefully to see if it's worthwhile. Cholesterol, really. I think on issue of the cholesterol now of a Chinese woman who never gets anything but rice, you're not considered suitable. And we have to, again, try to look at all these programs and see if, in fact, the issues in favour of them are weighed sufficiently against those which are against them. Thank you very much for having me.
I'm sure you enjoyed it, and thank you, Dr. Henry, for a very informative and delightful speech. It's also congratulating you on a very, very Dr. Henry, you were organizations, and the photographs were taken by our president, Leland Kunst. So we are so delighted to have you here and very much appreciate you.
Thank you.